The biggest hospital in Maputo is also the busiest health facility in Mozambique. And the Central de Maputo always operates at full capacity. But the pandemic has arrived in this African hub, and it's put this place under considerable strain.
We are working on this big thing to add more patients here. And we already had this one for the last 3 weeks, I think, just to increase the number of the beds, and we have 20 patients that are here.
Dr. Lucia Chambal may have trained in internal medicine, but now she's erecting tents and securing supplies in her role as COVID coordinator.
On the first wave, it was not that bad. We didn't have so many deaths, but this second wave is hard. It's getting hard for us.
The rate of infection in Mozambique has shot upwards, doubling, says the government, over the past 3 weeks. Yet most here think that's an underestimate, and Hospital Central is dealing with the consequences.
Are you surprised that you got sick?
Dangerous. Don't give time. You feel like something slowly, like you went air.
Have you had contact with your family?
No.
No contact with your family?
No.
It must be hard. It must be difficult.
It's hard. It's very hard.
Most Mozambicans, including the people who run this country, thought they had dodged the global pandemic. That changed in December when people came here for the holidays, bringing gifts, supplies, and the South African variant.
The time when the South African people coming to Mozambique to holidays, so the things starting like this.
Okay, you think they brought it here?
I believe so. Very scary and dangerous too.
Caught unprepared, other hospitals in the city are putting up wards run by newly qualified staff as they struggle with a surge in admissions. An emergency response that will soon be required by other African states.
We probably have this variant that's circulating like all over the sub-Saharan Africa. They have to be in front of the problem just to not have a burnout of the system.
In an attempt to contain the virus, Mozambique's president has implemented a curfew and a prohibition on private events. But it's difficult to ask people to stay at home.
If we stay at house, we'll stay hungry, you understand? We'll die. We'll not die about COVID, we'll die about hungry, yes. So we'll scared more about hungry more than COVID.
And the introduction of vaccines is unlikely to provide a solution in an impoverished nation of 30 million. We spoke to the coordinator of a prominent public health charity.
How long would it take for every Mozambican to receive a vaccine? Months? Years?
At least 3 to 5 years to arrive.
3 to 5 years?
Yes.
Wow. Okay. That's a long time.
That's a long time. You can have people living 50 kilometers from Maputo city, but never, for 50 years, never arrived to Maputo. They live there and won't come just to vaccination.
In Hospital Central, they are doing their best with donated tents and inexperienced staff and oxygen trucked in from South Africa. But they can't do much more than this. John Sparks, Sky News in Maputo.